Hello, my name is Emma DiMartino, and I'm here with Lindsay Masmery, Olivia Jones, and Andrea Maliver, and we are presenting our value proposition for an injectable hydrogel therapy that will be curated towards individuals with osteogenesis imperfecta.
Osteogenesis imperfecta is a rare genetic disorder characterized by fragile bones and frequent fractures. It's caused by defects in type 1 collagen synthesis, leading to insufficient bone matrix and poor structural integrity. The condition results in thin, brittle bones and can vary widely in severity. Common symptoms include blue sclera, dental problems, hearing loss, and short stature.
While this bone degenerative disease is known to be rare, as it only occurs in approximately 4.7 of every 100,000 individuals worldwide, living with this disease is extremely tedious and painful. Our team considers the treatment of this disease to be extremely important to the world as of right now, as there are no current bone regenerative medical treatments for osteogenesis imperfecta on the market. The current regenerative therapies are being studied as of right now, and they have not been put on the market. And the only current form of therapy is an intramedullary rod with an ostectomy. While this does correct the shape of the bones, it's extremely tedious procedure, and it often patients will have to go in for reprocedures, and it can often be harmful to the patient over time.
To treat bone fragility in osteogenesis imperfecta, we're developing an injectable hydrogel scaffold based on gelatin methacrylate. Within the scaffold, we incorporate beta-tricalcium phosphate microparticles, which promote mineralization and mimic the natural bone matrix. These microparticles are coated with a thin layer of PLGA, which provides additional structural support and allows for controlled degradation over time. Encapsulated within the PLGA coating are two growth factors: vascular endothelial growth factor, which promotes blood vessel formation, and bone morphogenetic protein 2, which stimulates bone regeneration. As shown in the image, the hydrogel is injected into the bone as a liquid, allowing it to fully fill the shape of the bone defect. Then, using ultraviolet light, the gel MA cross-links and solidifies in place, forming a custom-fit regenerative scaffold that supports both vascularization and new bone formation, helping restore strength to the weakened areas.
When we look at the patient impact of our scaffold, the benefits are clear. First, it helps reduce the risk of future fractures by promoting stronger, more resilient bone regeneration. Patients can also expect faster healing times thanks to the bioactive and supportive nature of the scaffold, which reduces overall recovery periods. In many cases, this means a lower likelihood of needing additional surgeries, especially invasive ones, and ultimately leads to better long-term mobility and quality of life. From the healthcare system's perspective, our design helps lower overall treatment costs by minimizing surgical interventions and reducing complication rates. Shorter recovery times also translate to fewer hospital stays and less strain on medical resources, making this solution beneficial to not just for patients but for healthcare providers as well.
Some of the current treatments for patients with osteogenesis imperfecta includes the taking of bisphosphonates, which are a type of medication usually used to treat osteoporosis and other conditions where the patient may have lower bone density and weaker bones. This treatment is able to help in fracture reduction as the bisphosphonates work to slow down bone resorption and strengthen the bones. However, bisphosphonates will not heal a bone fracture. The second available treatment is having a surgically implanted intramedullary rod with an osteotomy that helps reshape the bone for bone growth deformation correction and improving joint alignment. The rods are able to provide bone support, but they are highly invasive and high risk, as well as needing various correction surgeries and replacements. Our solution is one of the first injectable treatments that promotes bone growth and the development of blood vessels, as well as targeting the direct regeneration of bone growth and not the symptoms like pain, discoloration of the eyes, or joint hypermobility. This treatment, unlike some others on the market, is a non-invasive treatment and is built from clinical research.